Let me start with a question that surprises a lot of people. Why do so many people wake up with knee pain, even if they didn't injure their knees the day before? You go to bed feeling relatively fine, but when you wake up, the first few steps feel stiff, tight, even painful. And many people assume something dangerous is happening: cartilage disappearing overnight, joints suddenly wearing out, or arthritis rapidly progressing. But here's the truth. Most morning knee pain is not caused by sudden structural damage. It's caused by a temporary physiological state your body enters during sleep. And if you change what happens in the first 10-15 minutes after waking, you can dramatically change how your knees feel for the rest of the day. Here's what's really going on inside your body. During sleep, movement stops, circulation slows slightly, muscles relax, and the joint fluid inside your knees, called synovial fluid, becomes less evenly distributed. Think of synovial fluid as the oil inside an engine. When a car sits overnight in a cold garage, the oil settles and thickens slightly. When you start the engine in the morning, it takes a few minutes for that oil to circulate again. Your knees behave in a similar way. Overnight, joint fluid circulation slows, muscles around the knee shorten slightly, connective tissues stiffen, inflammatory molecules accumulate in the joint space. This is why morning stiffness is extremely common in people with knee osteoarthritis or chronic knee irritation. But here's the key point most people miss. The first movements of the morning determine whether that stiffness fades. If the first thing you do is jump out of bed quickly, walk downstairs immediately, load the knee joint with body weight while stiff, you're putting pressure on a joint that has not been lubricated yet. It's like revving an engine before the oil has circulated. Instead, the research and clinical experience show something powerful. Gentle movement in the morning improves joint circulation, mobility, and daily activity levels. For example, studies of people with knee osteoarthritis show that morning readiness for movement strongly predicts how active they remain throughout the day. In other words, your morning routine doesn't just affect your knees for a few minutes. It sets the tone for the entire metabolic and mechanical environment of your joints for the next 12-16 hours. Let me say that again because it's important. The first few minutes after waking are a biological window. During that window, you can either activate circulation, rehydrate joint tissues, stimulate synovial fluid flow, wake up stabilizing muscles around the knee, or you can accidentally reinforce stiffness and inflammation. And the good news? Fixing this does not require medication, injections, or surgery. It requires 3 very simple morning actions that work with your body's natural physiology. Over the next few sections, I'll walk you through the 10-second movement that wakes up synovial fluid, why dehydration overnight makes knee pain worse, the surprising role of morning insulin and inflammation, the muscle group that silently destabilizes the knee, and a simple 3-minute morning protocol that many physical therapists use with their patients. Because once you understand the biology behind knee pain, the solutions become incredibly practical. And if this kind of science-based breakdown is helpful so far, consider subscribing. Every day I share simple strategies to help people improve metabolism, mobility, and long-term health using physiology, not guesswork. Now let's move to the first mechanism most people never think about, the fluid inside your knees. Now let's talk about the first simple action that can dramatically reduce morning knee stiffness. And interestingly, it doesn't involve standing up. In fact, the best place to start is still in bed. Here's why. As we discussed earlier, your knee joint is filled with a specialized fluid called synovial fluid. Its primary job is lubrication, allowing cartilage surfaces to glide smoothly with very little friction. But synovial fluid behaves very differently from blood. Blood has a pump, your heart. Synovial fluid does not. Instead, it relies almost entirely on movement and pressure changes within the joint to circulate. Let me explain this with a simple analogy. Think of your knee joint like a sponge soaked in oil. When the sponge is compressed and released, the oil moves through it. But if the sponge just sits still for hours, like during sleep, the oil doesn't circulate. It settles. The same thing happens in your knee overnight. When you sleep for 6-8 hours, the knee joint barely moves. Synovial fluid circulation slows. Cartilage surfaces can become slightly sticky. Inflammatory molecules can accumulate in the joint. This is why so many people describe the sensation as rusty knees in the morning. Research shows that inactivity allows the lubricating fluid inside the joint to stagnate slightly, contributing to stiffness when movement begins again. But here's the encouraging part. A few gentle movements can restart the entire lubrication system. Even small movements create pressure gradients inside the joint, pushing synovial fluid across cartilage surfaces. Biomechanical studies show that synovial fluid behaves like a shear thinning fluid, meaning it becomes easier to move and lubricate the joint once motion begins. In simple terms, movement makes the joint fluid more effective at protecting your cartilage. This is why orthopedic specialists often say, motion is lotion for your joints. So here is the 10-second movement protocol I recommend every morning. Before standing up, do this. Step 1. Knee pumps. While lying on your back, extend your legs. Slowly bend one knee toward your chest. Straighten it again. Repeat 10 times. Switch sides. These gentle flexion and extension movements act like a hydraulic pump, circulating synovial fluid through the knee joint. You're essentially turning the lubrication system back on. Step 2, ankle pumps. Next, flex and extend your ankles 10-15 times. This activates the calf muscles, which help improve circulation through the lower limbs and reduce stiffness in surrounding tissues. Step 3, quad activation. Finally, tighten the front thigh muscle for 5 seconds, relax and repeat 5 times. The quadriceps muscle stabilizes the knee joint and helps distribute force properly when you stand. These 3 tiny actions take less than 1 minute, but they accomplish something important. They prepare the knee joint before body weight is applied, and this is exactly what protects the cartilage. Research and clinical guidance consistently show that gentle mobility exercises in the morning help stimulate synovial fluid circulation and improve joint readiness for movement. So instead of standing up with stiff knees, you stand up with a joint that has already been lubricated and activated. If this explanation is helpful so far, consider subscribing. Every day I break down the biology of metabolism, inflammation and aging into practical tools you can use immediately. Now let's move to the second hidden cause of morning knee pain. It's something almost nobody connects to joint health: overnight dehydration. Now let's talk about a factor that almost nobody connects to knee pain: hydration. Not just general hydration during the day, but what happens to your body overnight. Here's what's really going on inside your body. During sleep, your body continues to lose water through breathing, skin evaporation, and metabolic processes. By the time you wake up, most people are mildly dehydrated. In fact, sleep researchers often refer to the morning state as physiological dehydration. Now, this matters for many systems in your body: your brain, metabolism, and circulation, but it also matters directly for your joints. Because cartilage, the smooth tissue covering the ends of bones in your knee, is about 70–80% water, and synovial fluid, the lubricating fluid we discussed earlier, also relies heavily on proper hydration to maintain its viscosity and shock-absorbing properties. Let me explain this with a simple analogy. Imagine 2 sponges. One sponge is fully soaked in water. The other sponge has been left out overnight and has dried out slightly. Which one compresses and rebounds more smoothly? Obviously the hydrated sponge. Cartilage behaves very similarly. When hydration levels are optimal, cartilage can absorb compressive forces efficiently when you walk, climb stairs, or squat. But when the body is slightly dehydrated, which is common in the morning, cartilage can temporarily become less resilient, increasing the perception of stiffness and discomfort. Some biomechanical studies show that hydration status influences cartilage thickness and mechanical behavior under load. In other words, water balance directly affects how well your joints absorb impact. Now here's where this becomes practical. Most people wake up and do one of three things. They immediately drink coffee, they start checking their phone, or they rush into their morning routine, but they don't hydrate their tissues first. And caffeine, especially on an empty stomach, can increase mild dehydration in some individuals because of its mild diuretic effect. So here is one of the simplest joint supporting habits you can build. Within 5 minutes of waking up, drink 500-600 milliliters of water, about 16-20 ounces. This does several important things simultaneously. First, it replenishes fluid lost overnight. Second, it improves circulation to connective tissues and muscles surrounding the knee. Third, and this is fascinating, hydration helps support the osmotic balance inside cartilage, allowing it to reabsorb fluid and regain elasticity. Many orthopedic clinicians recommend adequate hydration as a foundational strategy for supporting joint function and reducing stiffness during movement. But we can improve this even further. Here is an optional upgrade that many metabolic health researchers recommend. Add a small pinch of mineral salt to your morning water. Why? Because sodium and trace minerals help the body retain and distribute water more effectively across tissues. Think of it as improving your body's cellular hydration system. The goal is not to drink massive amounts of water. The goal is to reprime your body's fluid balance after sleep. So the morning sequence now looks like this. First, gentle knee movement in bed. Second, a glass of water to rehydrate joint tissues. 2 simple steps. Already we are addressing 2 root causes of morning knee stiffness, joint fluid stagnation, overnight dehydration, and if this breakdown of the science is helpful so far, consider subscribing. Every day I share practical ways to improve metabolism, inflammation control, and healthy aging using tools that work with your physiology. Now let's move to the third mechanism that silently drives knee pain in the morning. It has nothing to do with the knee itself. It starts with a hormone your body releases every single morning. Cortisol. Now, let's talk about something that surprises many people when they first hear it. Your morning hormones can directly influence how much your knees hurt. And the main player here is a hormone called cortisol. Now, cortisol often gets a bad reputation. People hear the word and immediately think stress hormone. But physiologically, cortisol has an important role. Every morning, your body naturally releases a cortisol surge, known in science as the cortisol awakening response. Within about 30-45 minutes after waking, cortisol levels rise sharply. This surge helps wake up your brain, mobilize stored energy, and prepare your body for activity. It's essentially your body's natural morning alarm system. But here's where things become important for joint health. When cortisol rises, it also triggers changes in blood sugar regulation, immune signaling, and inflammatory pathways. And if your metabolism is already under strain from insulin resistance, poor sleep, or chronic stress, that morning hormone spike can amplify inflammatory signals. Let me explain this with a simple analogy. Imagine inflammation in the body as embers in a fireplace. Most people have a few small embers smoldering, low-level inflammation from diet, stress, or aging. When cortisol rises sharply, it can act like a gust of air on those embers. If the metabolic environment is healthy, nothing happens. But if inflammation is already present, those embers can briefly flare up. And joints, especially weight-bearing joints like the knees, are one of the places people feel it first. Research on osteoarthritis and inflammatory signaling shows that inflammatory cytokines inside joint tissue can fluctuate with systemic metabolic and hormonal states. In simple terms, your metabolic health influences how your joints feel. This is why many people notice something interesting. Their knee stiffness is worse on mornings after. Poor sleep, late night sugar intake, alcohol consumption, high carbohydrate late dinners. These behaviors disrupt glucose control and inflammatory balance, making that morning cortisol surge more inflammatory. But here's the encouraging part. There is a simple morning intervention that can stabilize this hormonal environment. And it only takes about 5 minutes of sunlight exposure. Within the first 30 minutes after waking, try to get natural morning light into your eyes. You don't need to stare at the sun, just step outside or stand near a bright window. This does something remarkable for your biology. Morning light helps regulate your circadian rhythm, which stabilizes cortisol timing and improves hormonal balance throughout the day. Research in circadian biology shows that morning light exposure improves metabolic regulation, sleep quality, and inflammatory balance. When cortisol rises at the right time and in the right rhythm, it actually supports healthy immune function instead of aggravating inflammation. So now our morning knee support routine looks like this. First, gentle knee movements in bed. Second, hydration with water. Third, 5 minutes of natural morning light. These three actions begin to correct joint lubrication, tissue hydration, and hormonal balance. And together they create a powerful environment for joint recovery. But we still haven't addressed one of the most common mechanical causes of knee pain. It's not inside the knee joint, it's actually a muscle group that sits above the knee and controls how the joint moves. And when this muscle is weak or inactive in the morning, it places enormous stress on the knee with every step dot. Now let's turn to one of the most overlooked causes of knee pain. And interestingly, the problem often isn't the knee itself. It's the muscle that stabilizes the knee. That muscle is the quadriceps, the large muscle group on the front of your thigh. Your quadriceps do something incredibly important. Every time you walk, stand up, climb stairs, or squat, they act like a shock-absorbing braking system for the knee joint. Let me explain this with a simple analogy. Imagine the knee joint as a hinge on a heavy door. If the hinge is supported by strong springs that control the movement, the door opens and closes smoothly. But if those springs are weak, the hinge suddenly takes the full force of the door's weight. Over time, the hinge wears down. Your quadriceps are those springs. They control how your body weight moves through the knee joint. In fact, biomechanical research shows that the quadriceps help distribute forces across the knee and reduce stress on cartilage and ligaments. Weak quadriceps are strongly associated with knee pain and osteoarthritis progression. But here's the key detail most people never realize. When you sleep for 6-8 hours, the nervous system temporarily downregulates muscle activation. Your muscles essentially enter a low-activity state. When you first wake up, the quadriceps are often not fully engaged yet. This means when you immediately stand up and start walking, your knee joint can briefly experience more mechanical stress than normal. In other words, the shock absorber isn't fully online yet. And if you repeat that pattern every morning for months or years, the cumulative stress can contribute to irritation inside the knee. But the solution is surprisingly simple. You can turn the quadriceps back on before standing. This takes about 30 seconds. Here's the activation technique. While still sitting on the edge of your bed, extend one leg straight in front of you. Tighten the front thigh muscle as hard as comfortable. Hold for 5 seconds. Slowly relax. Repeat 5 times per leg. This is called an isometric quad activation, and it does 2 important things. First, it stimulates the neuromuscular connection between your brain and the quadriceps. Second, it prepares the muscle to absorb force once you start walking. Physical therapists often use this exact technique in rehabilitation programs for knee pain because it safely strengthens the quadriceps without placing stress on the joint. And over time, stronger quadriceps can significantly reduce knee pain and improve joint stability. Now here's the powerful part. By this stage of your morning routine, you have already addressed 4 major root causes of knee stiffness: synovial fluid stagnation, overnight dehydration, hormonal inflammatory signals, quadriceps inactivity, all before your day even begins. And these steps take less than 5 minutes. If this kind of practical science-based guidance is helpful, consider subscribing. I share daily insights like this to help people support their metabolism, mobility, and long-term health naturally. But there is one more morning habit that can quietly fuel knee inflammation throughout the entire day. And it's something millions of people consume within minutes of waking up. It's not exercise, it's not aging, it's what most people eat for breakfast, Doc, now. Now let's talk about something that most people never connect to joint pain. Your breakfast. At first glance, it seems unrelated. Knee pain feels like a mechanical issue, something happening in cartilage, ligaments, or bone. But the body doesn't work in isolated compartments. Your joints exist inside a metabolic environment, and that environment is heavily influenced by blood sugar and insulin levels. Here's what's really going on inside your body. When you wake up in the morning, your body is already in a slightly elevated cortisol state, as we discussed earlier. Cortisol naturally raises blood glucose, so your brain and muscles have energy to start the day. Now, imagine adding a large spike of sugar or refined carbohydrates on top of that. This is exactly what happens with many common breakfasts: sugary cereals, white toast with jam, pastries, pancakes with syrup, sweetened coffee drinks. These foods digest rapidly and cause a sharp rise in blood glucose. In response, the pancreas releases insulin to bring blood sugar back down. But when this cycle happens repeatedly, it can promote a metabolic condition known as post-meal inflammation. Research in metabolic science has shown that high glycemic meals can temporarily increase inflammatory molecules in the bloodstream. These molecules include cytokines that influence tissues throughout the body, including joints. In fact, metabolic studies show that diets high in refined carbohydrates and sugar are associated with increased inflammation and may worsen symptoms in people with osteoarthritis. Let me explain this with a simple analogy. Imagine inflammation in the body like background noise in a room. When the metabolic environment is stable, that noise is very quiet. But every time blood sugar spikes sharply, it's like turning the volume knob up. And joints, particularly those already experiencing wear or irritation, often become the place where people feel that increased signal. Now here's the encouraging part. You don't need a complicated diet to stabilize this system. You just need to change the composition of your first meal of the day. Instead of a high-sugar breakfast, aim for a protein-dominant breakfast. Protein has two important metabolic effects. First, it produces a much smaller glucose spike compared with refined carbohydrates. Second, protein stimulates hormones that promote satiety and metabolic stability. Studies in nutrition science show that higher protein breakfasts improve blood sugar control and reduce cravings later in the day. So what does this look like in practice? Here are simple breakfast examples that support joint health and metabolic stability: eggs with vegetables, Greek yogurt with nuts and seeds, cottage cheese with berries, a protein smoothie with unsweetened ingredients, leftover fish or chicken with avocado. The goal is not perfection. The goal is metabolic stability. When insulin and glucose levels remain steady, inflammatory signaling throughout the body tends to decrease. And over time, that calmer metabolic environment supports healthier joints. So now your full morning routine looks like this: gentle knee movements before standing, hydrate your body after sleep, get morning sunlight to stabilize hormones, activate your quadriceps muscles, eat a protein-focused breakfast. Each step addresses a different root cause of knee stiffness and inflammation. But there's one final piece that ties all of this together: a short morning habit that improves circulation, joint lubrication, metabolism, and muscle activation all at once. And the good news? It only takes 3 minutes. Now let's put everything together. Because the real power here is not just understanding individual mechanisms, hydration, hormones, muscle activation. The real power comes from stacking these small biological triggers together. When you do that, something interesting happens. You create a morning routine that supports joint lubrication, circulation, metabolic stability, and muscle support all at the same time, and the entire routine takes about 3 minutes. Let's walk through the protocol step by step. Imagine you've just woken up. Instead of jumping out of bed immediately, you give your body a brief moment to prepare your joints for movement. Step 1. Activate joint lubrication. While still lying in bed, gently bend and straighten each knee about 10 times. Then perform ankle pumps, flexing your feet up and down for about 15 repetitions. This movement acts like a pump inside the joint. It pushes synovial fluid across cartilage surfaces, which helps restore lubrication after hours of inactivity. Remember the analogy we used earlier. Your joints are like an engine that sat overnight. This movement simply allows the oil to circulate again. Step 2. Hydrate the system. Once you stand up, drink a large glass of water, about 16 to 20 ounces. If you want to go one step further, add a small pinch of mineral salt. This helps replenish fluid lost overnight and supports hydration of connective tissues. Because cartilage and joint fluid rely heavily on water balance, this simple step helps restore the elastic properties of the joint before the day begins. Step 3. Turn on the knee stabilizers. Sit on the edge of the bed and perform 5 quadriceps contractions per leg. Extend the leg, tighten the thigh muscle, hold for 5 seconds, then relax. This reconnects the nervous system to the quadriceps muscle, the primary shock absorber protecting the knee. When that muscle is activated before walking, it reduces mechanical stress on the joint. Step 4. Expose your body to morning light. Step outside or near a window for about 5 minutes. This regulates your circadian rhythm and stabilizes the natural morning cortisol surge. A well-timed cortisol rhythm helps maintain metabolic balance and reduces inflammatory signaling throughout the body. In other words, you're setting the hormonal environment that your joints will operate in all day. Step 5. Choose a metabolically stable breakfast. Instead of starting the day with sugar and refined carbohydrates, choose a protein-centered meal. Protein helps stabilize blood sugar, which prevents inflammatory spikes that can aggravate joint tissues. So in just a few minutes, you've addressed 5 root causes of knee stiffness: joint lubrication, hydration, muscle activation, hormonal balance, metabolic inflammation, and none of these steps require medication, equipment, or complicated routines. They simply work with your body's natural physiology. Now, an important point: these changes don't usually eliminate knee pain overnight, but when practiced consistently, they improve the biological environment surrounding the joint. And that environment is what determines whether joints gradually become more irritated or gradually recover, because the body is constantly remodeling tissues, and when you remove the daily stresses that fuel inflammation and instability, the body can often begin to repair and adapt. So let's step back and look at the bigger picture. Knee pain is often treated as if it's purely a mechanical problem, something worn out, something damaged, something that simply gets worse with age. But the science tells a much more hopeful story. Your joints are not static structures. They are living biological systems constantly responding to signals from circulation, hormones, muscles, hydration, and metabolism. And what we've explored today is something powerful. There's a growing community of people here focused on improving metabolism, mobility, and long-term health naturally, using science, not guesswork, and I look forward to sharing the next one with you.